Hello, my name is Fallon Moore. I'm an occupational therapy doctorate student at Pacific University. My capstone experience and project were focused on utilizing trauma-sensitive mindfulness with foster and adoptive families. I partnered with the Oregon Post-Adoption Resource Center, also known as ORPARC, for my capstone. ORPARC provides free, confidential, compassionate, trauma-aware, and adoption competent services for the entire state of Oregon for foster, adoptive, kinship, and assisted guardianship families, as well as the child welfare workers and adoption professionals who serve them. I want to note briefly that foster parents are now officially called resource parents, though the term resource can get a bit confusing since I'll be talking a lot about resources throughout my presentation. So I'll primarily use the term foster just to reduce confusion. ORPARC provides support services, consultation, resources in the form of their comprehensive library and digital library with numerous videos, podcasts, books, and more, as well as information packets on various topics available both digitally and in print, as well as trainings, including on therapeutic life story work and all about me books, among many others. I decided to work with ORPARC because I became curious about what supports resilience for children with histories of trauma, especially those who have experienced the child welfare system. I wanted to learn more about the potential benefits of using mindfulness-based interventions, not just with children in care, but also with their adoptive and foster families. I discovered that occupational therapy has a lot to offer this population because families are adjusting to new life rhythms and dealing with challenges related to children's histories of trauma. These histories can create unique challenges within the family unit that impact many areas of daily life, including emotional regulation, sensory processing, relationships, and behavioral and mental health. Based on current research, mindfulness shows great promise to support families with these specific challenges. I'll talk a little bit more about that next. Children who have experienced the child welfare system often have histories of trauma, chronic stress, and abuse, and their caregivers are also likely to have experienced trauma, since an estimated 70% of US adults have experienced at least one traumatic event in their lifetime. When delivered using a trauma-sensitive approach, mindfulness can support positive adaptation for children and families, which enhances their resilience and overall well-being. However, mindfulness is often not accessible for families, and many resources are not trauma-informed. Throughout my capstone experience and project, I set out to increase accessibility of trauma-sensitive mindfulness tools using an OT lens to ensure that busy, stressed families are able to integrate mindfulness into their daily life. Mindfulness pairs particularly well with occupational therapy because it can be easily implemented in a variety of settings with people across the lifespan, with both individuals and groups. And mindfulness is now widely recognized as an evidence-based mental health intervention. In the literature, there were limited studies specifically looking at using mindfulness-based interventions with foster and adoptive families. Therefore, I broadened the scope of my research a bit to include literature that investigated using mindfulness with children and adults with histories of trauma. The current evidence suggests that mindfulness has the potential to bolster psychological resilience to trauma and adversity, as well as improve physical, behavioral, and mental health outcomes among children and adults exposed to trauma. Mindfulness-based interventions are also associated with improved emotional regulation, reduced parental stress, greater relationship satisfaction, and reduced behavioral problems in children, among many other benefits. It is clear how these potential benefits can improve outcomes for children in care and their foster and adoptive families. These benefits can support overall well-being as well as attachment, which plays a huge role in the health of family systems. Now I'll talk a bit more about the models and theories that informed my capstone work. The Kawa model, which means river in Japanese, is an occupational therapy model that uses the metaphor of a river to symbolize a person's life. Rocks symbolize obstacles that are difficult to move and can impede a person's life flow. Driftwood symbolizes attributes and resources, and these can either positively or negatively impact life flow by either creating obstructions when combined with rocks or nudging obstructions out of the way. The riverbed symbolizes contexts and environments, and the river represents the client, and the river itself can carve out and change the shape of the riverbed. The Kawa model is an ideal model to use when working with adoptive and foster families because it emphasizes the importance of context and respects the profound and complex interrelationship of all the elements within a person's life. It also sees clients not just as individuals, but as families and communities, which I thought fit really well with this population. According to the Kawa model, when all the elements are working together in harmony, then a person's life flow is optimized. My capstone project and experience were also guided by transdisciplinary resilience theories, which focus on strength-based perspectives and resilience promoting processes rather than fixing deficits. When serving adoptive and foster children and families, it becomes critical to understand resilience not only from the perspective of an individual's attributes, but also from the lens of how society influences resilience. And that's part of why I thought resilience theory and Kawa model fit really well together as well. A core part of what occupational therapists do is provide education to enable our clients to reach their goals. We often teach our clients different skills, whether our clients are individuals or family systems. When using the Kawa model, mindfulness skills can be seen as driftwood, which can help nudge obstructions out of the way to improve life flow. Mindfulness can be a powerful tool to create more space by improving coping skills to manage stress and build resilience. This enhanced life flow ultimately contributes to improved health and well-being, according to the Kawa model. But families need accessible, trauma-sensitive mindfulness tools to create this space and enhance their life flow. My project aimed to do just that by collating and adapting mindfulness resources to make them as accessible as possible for busy and often stressed families to build their resilience. A little more on how my project developed. I conducted a comprehensive needs assessment, including research, interviews, and education. My research included reading numerous books and articles and listening to experts in the field of mindfulness and trauma recovery, as well as adoption and foster care. I also conducted in-depth interviews with key ORPARK staff to learn more about the needs of families. Additionally, I completed trainings and continuing education on interventions that utilize mindfulness in their approach, such as trust-based relational intervention and the resilience toolkit. Through interviews and research, I learned that it is especially difficult for parents and children to learn and listen when they are constantly in a hypervigilant and dysregulated state due to all the trauma they have experienced. I learned a lot about trauma-sensitive mindfulness, guided by the work of Dr. Trelevin, whose work focuses on the intersections of trauma, mindfulness, and social justice. I attempted to implement the principles of trauma-sensitive mindfulness throughout my capstone experience and project to ensure that families can experience some of the benefits of mindfulness. My site and I agreed that one component of my project would be to explain what mindfulness is and guide families through some simple activities, as well as translate the research on the benefits of mindfulness in simple language that families can easily understand. I used what I've learned about health literacy and universal design for learning to simplify language, use large font, minimize text, highlight important points, and create graphics to visually depict concepts. My primary objective was to collate and develop resources for a multimedia mindfulness and resilience toolkit using strategies from an OT lens. Additionally, my secondary objective was to collaborate with ORPARK staff to develop additional information packets and resources to bolster resilience. I'll talk more about each of these next. Some highlights from my capstone experience include advocating for occupational therapy in emerging settings, such as post-adoption services, as well as bridging occupational therapy, the profession, with others who are actively promoting and practicing trauma responsive care. I also assisted with compiling relevant resources for families and professionals and implemented mindfulness activities as a co-leader of social skills groups for children at Skyhook Counseling Center. My project, which primarily was developing the mindfulness and resilience toolkit, included a short video to be shared with ORPARK parent support groups that introduces mindfulness and guides families through a brief mindful breathing activity designed to reduce stress in everyday life. I also developed 2 information packets, one geared more toward children and teens with simple activities to develop mindfulness skills, as well as one geared more toward parents and caregivers with more robust information and resources. Both are a collation of resources designed to make mindfulness as accessible as possible. I also helped develop the mindfulness and resilience resource page for the ORPARK website, which includes many helpful resources such as websites, podcasts, videos, articles, and guided practice opportunities, both for parents as well as for children and teens. This web page can be accessed as needed and includes a variety of different resources to accommodate different learner needs. And some resources are also available in Spanish. A note on limitations. Due to time constraints and other factors, measuring the impact of my capstone work was limited. My original idea was to develop and administer surveys for people who utilize the resources to get feedback on how they were received. The data collected on the outcomes could be used to update and revise and develop new resources to better meet the needs of families. ORPARK staff did share with me that the projects I worked on had a positive impact on many families and workers, and they also assured me that my contributions will support countless others long after I'm gone. To recap some main points, when delivered using a trauma-sensitive approach, mindfulness can strengthen psychological resilience to trauma and adversity, and it can improve physical, behavioral, and mental health outcomes among children and adults exposed to trauma. The occupational therapy profession is well equipped to integrate mindfulness-based interventions into our services across the lifespan and within diverse settings for individual clients as well as groups. We have the specialized knowledge and skills to increase accessibility of mindfulness interventions and tailor them to the specific needs of the clients we serve, including foster and adoptive families. I hope my capstone project demonstrated this and inspires others to learn more about using mindfulness within OT practice. Thank you so much for watching my capstone presentation. I hope it inspired you to learn more about the benefits of mindfulness to support resilience and improve outcomes, especially with foster and adoptive families.